Hello, my name's Dr. Nigel Lester. I'm a psychiatrist and I'm Director of Mental Health for Palm Health. The purpose of this short video presentation is to help introduce you to the InSight program and hopefully answer some of the questions that you may have. One of the things that we recognize very clearly at Palm Health is that physical and mental health are inextricably intertwined. Often our ability to manage stress or our inability to manage stress or difficulty in coping with life transitions or challenges that life throws at us is a direct cause of our physical ill-being. And without mental well-being, we cannot achieve our optimal physical health or our optimal performance in life, let alone find happiness and satisfaction in the things that we do. Oftentimes, we know we need to make changes, but we procrastinate or we just feel stuck. Sometimes the transitions that face us are just too overwhelming, or the stress just becomes too much and we don't know how to move forward. We feel overloaded or we become burnt out. And it's at those times that we often recognize that we need to delve a little deeper into our own ability to manage stress and our own coping style. So it's for this reason that we designed the InSight program, which is a one-week intensive assessment experience, which is intended to help you learn more about yourself, your own ability to manage stress, your current lifestyle choices and any changes you might want to make, and the things in your life that may be interfering with your ability to transition, to adapt, and your overall resilience to life's challenges. We wanted to create an intensive experience that would help you gain more self-awareness and self-knowledge and understand what helps build your own well-being and have clear steps that you can take that would help you work on your personal stress management and your personal life goals. Oftentimes, when people address their physical health, they will seek out many opinions and they will look into many options. But when it comes to mental health, looking into mental well-being, people are often very unsure where to start and take very tentative first steps. And so the InSight program is designed to try to help you dive right in and launch you into learning about the things you could do to make stress more manageable and make healthy lifestyle choices for your well-being overall. So the idea of the week is that you will have an experience which includes meeting with various professionals. So you'll have a virtual mental health visit with a psychiatrist, myself. You'll have an opportunity there to look at your overall mental health, to look at some of your past issues that have brought you to this place, and to get some perspective on your own personality and coping style. You'll have a counseling session with one of our licensed counselors in order for you to explore more about the stresses and challenges that face you today. You'll take the Temperament and Character Inventory, which is a personality test developed by my colleague, Dr. Cloninger, an emeritus professor at Washington University in St. Louis, which is a unique and highly regarded test, which gives you very in-depth knowledge of your own temperament style, your emotional style, and your character development. In recognizing the interaction between your physical health and your physical health lifestyle choices, you'll also meet with our functional medicine nurse practitioner who will look in particular at diet and exercise and how those things might be impacting on your current state. We'll introduce you to some vital tools to help you become calm and relax so that you can become aware and increase your ability to self-reflect and think creatively. First amongst those being psychophysiological coherence or cardiac coherence, which one of our well-being coaches will introduce you to and help you begin to practice. And then all of these various assessments will be pulled together in a summary and a review visit with one of our licensed clinical social workers who will help you develop your bespoke plan to start you on your road to sustainable changes in your own stress management and your own mental well-being. There's a program coordinator who will help you keep on track with the various appointments and who can help you sort out any conflicts or timing or changes as you go through the week. Many eyes are better than one, and by meeting with lots of different people, you'll be getting different perspectives, which we can then draw on in order to get a more in-depth understanding of the challenges you face. This is an experienced team who's been working together in this way for 6 years now, and we've developed a very refined understanding of how this process of helping people begin to understand themselves better works. It is an intensive week, and the idea is that you will understand yourself, your personality, your coping style, your challenges, and your blockages to overcoming these challenges. And we hope that this will be an efficient and effective way to do this, to launch you so that you really do start to implement and action the ideas that you develop during this week. So we hope to inspire you, to educate you, but also to focus you, and so that you can become more effective and have a better perspective to construct the right sort of plan for you, to search out the right kind of tools for you, but also to gain the right kind of perspective for you. At Palm Health, we don't believe in quick fixes. Many clients that we've met have worked and spent time and money in retreats and residential programs. And whilst these do serve a great purpose, the experience is often that when you return home and when you go back to normal life, the same challenges occur and the same dysfunctional patterns emerge. Palm Health is based in the community. We are a community support, and the major thrust of the InSight program is to help you develop ongoing strategies in your community, to make incremental changes, to help change your thoughts, your behaviors, and your lifestyle in a way that's sustainable over time and a way that incrementally adds up to lasting change. And above all that, we hope to cultivate an overall sense of self-reflection, self-awareness, ongoing learning and education, changing your perspective so that you continue to grow in your own ability to be your own best companion in the ongoing challenges that change and adaptability and stress management will present to all of us. We truly understand the difficulties of transitions, the difficulties of managing stress, the difficulties of adapting, of developing resilience. We truly understand that to be at our peak, to deal with these life challenges, whether it's with your family, with your work, your education, or just the world around you, or your physical and mental well-being are absolutely inseparable. So neglecting your mental well-being will often be the root cause of many other problems. So the InSight program, therefore, is aimed at someone who realizes that there's a lot to learn, wants to manage stress better, wants to overcome all of the manifestations of this poor coping or being overwhelmed, the fear, the worry, the anxiety, the sadness, the emotional heaviness that weighs on us and weighs on our physical health and our overall performance. It's for the person who's ready and motivated to do something about it. And it's an intensive week for that reason, to help you dive right in and start taking responsibility. Let me say a few words about what the InSight program is not intended to do. So it's not intended to be an ongoing psychiatric or psychological care program for individuals who have established or emerging diagnoses of severe mental illness. If you have concern that you or someone you care about may have a severe mental illness, we can recommend to you some highly regarded psychiatric services in our community. And similarly, InSight is not intended to address an ongoing or active struggle with substance abuse or addiction. If you feel ready to tackle a substance use problem, then again, we can recommend rehabilitation programs, both residential and outpatient, that are oriented to supporting just that problem. if you have a friend or relative in mind who you think would benefit from the InSight program, you need to be clear that they are ready themselves to take responsibility, to make changes, and can do so under their own motivation. If they're not ready to engage, then it will be very difficult for them to benefit from InSight. We find that the most positive outcomes will be affected when the client is absolutely at that point where they are motivated, they want some help and guidance. So similarly, it would be not appropriate for someone who has some kind of significant cognitive impairment or dementia, a diagnosis of a severe eating disorder, personality disorder, or, as I said, ongoing active substance abuse disorder. However, there are a lot of people who are ready to make changes and do see that the challenge of mental well-being is an essential part of not just physical health, but overall coping in a stressful world. And that's precisely why we designed the InSight program. We have 6 years of experience of working together as a team, and we find that the team approach gives us the most insight, the most efficiently and in the most depth, and allows us to very quickly help throw light on some of the blockages and challenges that we all face when trying to achieve optimal mental and physical well-being. Thanks for your interest in the InSight program. I hope this short video has helped answer some of your questions. And if you are interested in the InSight program, please talk to the navigator, and they'll let you know the practicalities of how you can set up your own program. If you have further questions, the navigator will endeavor to help you, and if they can't answer the question, they'll find someone who can. Thanks for your interest, and I wish you all the best of luck.